This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today.
Welcome to The Deep Dive, the 21st Century Man podcast. We're here to take a really close look, chapter by chapter, at the book The 21st Century Man.
That's right. Our goal is to basically pull out the expert knowledge, the key stuff from these specialists who wrote the book and just lay it out for you.
Exactly. Make it actionable. Make it understandable.
Yeah. Cut through the jargon, get to the heart of what matters for men today.
And today, we are turning our attention to chapter 94. This one's all about vasectomy.
A pretty significant topic for a lot of guys and couples thinking about family planning down the line.
And the chapter is written by an expert, Dr. Judson Brandeis, who's a urologist. So we're getting this straight from someone who, well, does this procedure.
Which is exactly what you want for this topic. It's practical. It answers the real questions people have, from the basics right through to recovery and, well, even changing your mind later on.
Yeah, the chapter even starts with this kind of interesting quote. Vasectomy means never having to say you are sorry.
Yeah, a bit tongue-in-cheek maybe, but it definitely points to the decisiveness of it. It's meant to be permanent.
Right. And that permanence is key. But like you said, the chapter also balances that with how effective and safe it is.
Definitely. Understanding all those facets is crucial if you're weighing your options.
So let's jump in. Let's deep dive into chapter 94 of The 21st Century Man.
Okay, let's start with the fundamentals. What exactly is a vasectomy, according to the source?
Well, the chapter puts it right out there.
Yeah.
It's one of the safest and most effective methods of permanent birth control available. Emphasis on permanent.
And it makes a direct comparison right away, doesn't it, to female sterilization, tubal ligation.
It does. Says vasectomy is much easier and, importantly, less expensive for the man compared to the woman getting her tubes tied.
And that difference, the ease and cost, seems to be a pretty big factor for couples.
Yeah, you'd think so. And it shows in the numbers. The chapter says it's the go-to choice for about 20% of couples in the U.S., Canada, and the U.K.
1 in 5 couples in those places. That's quite common.
And globally, the numbers are huge. 50 million men worldwide get a vasectomy every year.
50 million. Wow. And in the U.S. alone?
About 500,000 American men annually.
Yeah.
500,000.
So 500,000 decisions like this in the U.S. each year. It really underscores that point about it being, less expensive and safer than tubal ligation, especially since it's done under local anesthesia.
Exactly. That cost and safety difference seems to be a major driver for why couples choose this route.
And let's not forget that key benefit mentioned right at the start, the success rate.
Oh yeah, 99.9% effective. That's incredibly high.
Almost foolproof, really. We'll get into why it's so effective later, but that number alone is a big draw.
Okay, so effectiveness is top tier. But beyond just preventing pregnancy, what about the other benefits? The chapter gets into impacts on a man's health, his sex life, the stuff guys really wonder about.
Right. So number one is that 99.9% effectiveness we just mentioned. I mean, finding anything else that reliable is tough. That certainty is huge for couples wanting a permanent fix.
Definitely peace of mind there. Now, health concerns. What about worries like, say, cancer risk? Does the book address that?
It does, very directly. The source says there is no risk of health issues like prostate or testicular cancer linked to vasectomy. Full stop.
Okay, that's good to hear laid out so clearly. Debunks a common myth right there.
Yeah, important reassurance.
What about hormones? Does messing with the plumbing affect testosterone?
Nope. The source confirms no change in testosterone levels. So all those things, T levels influence energy, mood, muscle, sex drive. They aren't affected by the procedure itself.
That's huge. And, okay, the big one for many guys, erections.
Also unaffected. The chapter is explicit. Vasectomy does not affect erections. Performance isn't impacted.
Okay. And sensation. Orgasm. Does anything feel different?
Again, a clear no from the source. Doesn't affect sensation. Doesn't affect orgasm. The physical experience of sex remains the same.
What about ejaculation? Does it look or feel different afterwards?
That's a common question. The source explains that the actual volume of ejaculate is pretty much identical. Sperm only make up a tiny fraction, like 2% of the total volume.
So the fluid's still there, just without the sperm.
Exactly. Once the pipes are clear to the old sperm, it looks and feels the same. No noticeable difference for the man or his partner.
Huh. Good to know. And finally, what about recovery in terms of, getting back to daily life?
This is another big plus highlighted. Most men can return to a desk job the very next day.
The next day.
Yep. Minimal downtime, especially compared to, say, Tubal ligation recovery, it's a really practical benefit.
Wow, okay, so you add it all up. Super effective, safe long-term, no hormonal changes, no impact on sex or sensation, looks the same, feels the same, and a quick return to work. It makes sense why it's so common.
Yeah, the chapter really lays out a compelling case by addressing those key concerns directly.
All right, so to understand how it works, we need a quick anatomy lesson. The chapter breaks down the relevant parts pretty simply.
Yeah, it helps picture what's actually happening. So first you've got the testicles. Oval things, size of chestnut sitting in the scrotum. They make sperm and testosterone.
Got it, the factories. Where do the sperm go next?
Into the epididymis. It's described as this highly convoluted duct, like a tightly coiled tube on the back of the testicle. That's where sperm mature and learn to swim, basically.
Factory, then the finishing school. What carries them out?
That's the vas deferens. These are the fine tubes, like tiny spaghetti strands, that transport the mature sperm up from the epididymis, out of the scrotum, and towards the penis.
And these are the tubes that get cut in a vasectomy.
Exactly. There's one of vas deferens for each testicle, and the procedure targets these specific tubes.
Okay. And eventually those tubes lead to the urethra.
Right. The urethra runs through the penis. It's the same tube that carries urine out, and it's also the exit route for semen during ejaculation.
So normally, before vasectomy, the vas deferens contracts, pushes sperm up, they mix with fluids from elsewhere to make semen, and out it goes through the urethra.
That's the pathway. And the vasectomy simply cuts and blocks the vas deferens tube.
Interrupts the delivery route.
Precisely. No sperm can get into the final mix that comes out.
Makes sense. So who does this procedure and where?
The chapter says urologists do about 80% of them. The rest are often done by trained family doctors or general surgeons. And crucially, it's usually done right there in the doctor's office.
An office procedure. And you mentioned local anesthetic.
Yep, standard practice. You're awake, but the area is numb.
The source also talks about a specific, more modern technique.
The no-scalpel vasectomy,
Yeah.
developed back in the 70s in China, apparently, and it caught on fast.
Why? What's better about it?
It's safer, less invasive. That means less discomfort, quicker recovery. Instead of making a cut with a scalpel,
They do what?
they use a special tool to make just a tiny puncture in the scrotal skin to get to the vas deferens. Much less tissue disruption than an actual incision.
Okay, tiny puncture versus a cut. Sounds less intimidating. All right, so that's the procedure. What about preparation? What do you need to do before you go in?
Few key things. First, legally, you need to sign a consent form at least 72 hours beforehand.
3 days notice. Why the waiting period?
It's a cooling off period, basically. Ensures it's a well thought out decision, not something rushed. Given that it's permanent, that makes sense.
Totally. What about meds? Anything to avoid?
Yes, big one. No aspirin or NSAIDs. That's things like Motrin, Advil, ibuprofen, Aleve for about a week before.
Why those specifically?
They thin the blood, increase bleeding risk. The doctor wants to avoid any extra bleeding during or after, so stopping those meds beforehand helps minimize that risk.
Got it. Avoid blood thinners. Now, that local anesthetic, what's the numbing part actually like?
The chapter compares it to getting numbed up at the dentist. Might be a brief moment of discomfort like a sting or pressure when the needle goes in.
A little ouch at the start.
Potentially, yeah.
Yeah.
But the source is quick to add that once everything's numbed the skin, the vas deferens, you rarely feel any actual pain during the procedure itself.
Okay, so a fleeting discomfort for a generally painless procedure once the numbing kicks in. Good to know. All right, procedure's done. What about recovery? Any stats on complications?
Yeah, the chapter gives some numbers, partly from Dr. Brandeis' own practice, which are pretty reassuring. Bleeding afterwards, less than 1%. Very rare.
Okay, less than 1 in 100 for bleeding. What about significant pain?
Fewer than 2% have pain bad enough that it really impacts their quality of life.
Yeah.
So some soreness is expected, but serious pain is uncommon.
Infection.
About 1% to 3% might get an infection needing antibiotics. Again, pretty low for any surgical procedure.
And there was mention of troublesome post-vasectomy pain.
Right, that's different from the initial soreness.
Mhm.
Fewer than 10% develop that kind of more persistent pain. We'll talk more about what that actually is in a minute.
And Dr. Brandeis shared his personal stats, too.
He did. Said in about 3,000 vasectomies, he only had one guy need extra treatment for bleeding, which is amazing. Infection needing antibiotics.
Yeah.
About 1 in 100 in his experience, lining up with the general stats.
So his real-world results back up the low complication rates.
Exactly. And he also mentioned that failures where the tubes reconnect on their own are extremely rare in his practice. Adds to the confidence in its permanence.
That firsthand experience is valuable context. Okay, let's get practical. What are the actual post-op instructions? What should you do or not do?
All right, so work-wise, like we said, desk job, usually fine the next day.
Okay. Sex?
Hold off for about 4 to 5 days, let things heal up a bit, reduce strain on the area.
Pain management?
Most guys just need over-the-counter stuff, Tylenol, maybe Motrin or ibuprofen, once the bleeding risk is past. The source stresses it's unusual to need anything stronger, like prescription painkillers.
Good. Standard stuff usually does the trick. Exercise.
Mild exercise is okay after about 4 days. But, and this is important, avoid vigorous exercise, bike riding, sit-ups, heavy core workouts for at least a week.
Why those specific activities?
They put strain on the groin and abdominal muscles, which connect down to the scrotum. You want to avoid putting stress on that healing area initially.
Makes sense. Give it time. Bathing. Showering.
Showering's fine, even the night of the procedure. But no baths, jacuzzis, or swimming pools for about 4 days.
Keep the wound site dry and clean, basically.
Yeah, mainly to reduce infection risk while the tiny puncture site heals. Submerging it, especially in shared water, isn't ideal right at the beginning.
Okay, clear instructions. Now, the big confirmation step. How do you know for sure it worked?
Semen testing. This is crucial. The source says you need to get tested after about 20 ejaculations and after about 8 weeks have passed.
Both. Why the combo of time and activity?
The time lets things heal and settle. The 20 ejaculations, roughly, are needed to physically flush out any sperm that were already downstream in the vas deferens before it was cut. They need to be cleared out.
Ah, so there are still live rounds in the chamber right after the procedure?
Pretty much, yeah. The test confirms that the ejaculate is completely free of viable sperm after that clearing process. Passing that test is the green light.
And what's the ejaculate like during this time and then after you get the all clear?
Initially, it might still contain those leftover sperm. But once the tubes are flushed clear, the source says ejaculation looks and feels exactly the same as before.
Because the sperm volume is so tiny, right?
Precisely. The book uses a great analogy. It's like having the whole swimming pool, but no swimmers.
Huh. I like that. Very clear image. The fluid's there, the swimmers aren't.
Exactly. Easy to grasp.
Now, any mention of long-term complications years down the road from the vasectomy itself?
Another point of reassurance here. The source explicitly states there are no long-term complications mentioned arising from the procedure itself. Doesn't cause chronic diseases or problems later in life.
Okay, let's circle back to that troublesome post-vasectomy pain, the less common, more persistent kind. What's going on there?
Right. So normal soreness usually fades in a few weeks. The source says it's unusual for pain to last longer. This persistent ache is often called post-vasectomy pain syndrome.
And what causes it?
The main theory discussed is chronic congestive epididymitis. Basically, the testicles keep making sperm and fluid, but since the vas deferens is blocked, that stuff backs up into the epididymis, that coiled tube where sperm mature.
The warehouse gets overstocked because the delivery trucks aren't running.
Good analogy. Yeah, that backup causes the epididymis to swell. For most guys, this causes no symptoms at all. But for a small percentage, it leads to this chronic, dull ache in the testicles, often made worse by ejaculation.
Ah, the pressure builds up. Makes sense why ejaculation might aggravate it. So how is it treated?
First-line therapy is NSAIDs, Motrin, ibuprofen to reduce inflammation, plus warm baths to soothe the area.
Okay, so the meds you avoid before are the ones you use after if this specific issue pops up.
Exactly. If that doesn't cut it, or for more severe cases, the source mentions pain specialists can do local nerve blocks or steroid injections.
And Dr. Brandeis had a specific take on this, based on his technique.
Yeah, interesting point. He mentions he doesn't typically use clips to block the vas deferens, preferring other methods. And he says because of this, he rarely sees patients with this post-vasectomy pain syndrome.
Implying the way the vase is blocked might influence the risk of this backup issue?
It seems so. He adds that if his patients do get some inflammation causing pain, he usually treats it with a short course of oral steroids, and that typically resolves it quickly. He really emphasizes again that persistent pain beyond a few weeks is extremely rare in his experience.
That's reassuring. So it's a known possibility, but uncommon, maybe linked to technique, and usually treatable.
Right. Puts it in perspective.
Now, a really important consideration. What if life changes and someone does want to have children again after a vasectomy? The chapter addresses this, right?
Absolutely. It acknowledges that circumstances change, divorce, remarriage, loss, and the desire for fertility might return. It outlines the options.
What are they?
Well, one is sperm banking, but that has to be done before the vasectomy, kind of like insurance.
Right, planning ahead. What if you didn't do that?
Then there's harvesting sperm directly from the epididymis. Since the testicles keep producing sperm, they collect in that warehouse. They can be retrieved surgically and used, typically with IVF, in vitro fertilization.
Go straight to the source, bypass the block tube.
Exactly. And the third option, which gets a fair bit of detail, is vasectomy reversal.
Okay, let's look at reversal. Why do men seek it out?
Usually, as the source says, due to major life changes. Remarrying and wanting kids with a new partner is common, or sometimes after the tragic loss of a child.
And the medical choices then are basically reversal surgery or IVF using retrieved sperm.
Those are the two main paths. The chapter suggests couples need to weigh things like how many more kids they want, the time involved, the cost, and crucially, the female partner's age.
How do reversal and IVF compare on those points?
Reversal is generally more cost-effective than potentially multiple IVF cycles. And it's often the preferred route if the couple wants more than one child and the female partner has good fertility.
Why preferred for multiple kids?
Because a successful reversal restores the natural clumping, potentially allowing for multiple natural conceptions over time without more procedures. IVF is usually geared towards achieving one pregnancy per cycle, though embryos can be frozen.
Makes sense. Restore the system versus targeted intervention. But the reversal itself sounds tricky.
Extremely. The chapter emphasizes this. You're reconnecting tubes that are incredibly tiny.
How tiny are we talking?
The vas deferens inner channel is about 1/1100th of an inch. That's like 0.3 to 0.5 millimeters. If they have to connect to the even smaller epididymal tube, that's 1150th of an inch, maybe 0.1 to 0.2 millimeters.
Whoa, that's microscopic surgery.
Definitely. The book uses the analogy of trying to sew together tubes the width of a paperclip wire. It requires specialized microsurgical skills.
So the surgeon's experience must be critical.
Absolutely paramount. The source states the medical literature clearly shows success rates directly correlate with the surgeon's experience. Choosing someone highly skilled in these micro techniques is key if you go this route.
What does the reversal procedure involve? How long does it take?
Can be done under general or local anesthesia, usually a small scrotal incision similar to the vasectomy, but it's a much longer operation, typically 2 to 4 hours because of the delicate work.
And what determines success? Getting the tube open and then actually achieving pregnancy.
Two main factors highlighted. First, how long it's been since the original vasectomy.
Longer wait, lower chance.
Generally, yes. More time allows for more scarring and changes that can make reconnection harder. Achieving patency, getting the tube open, becomes less likely the longer the interval.
Okay, and the second big factor, especially for pregnancy.
The age of the female partner. This is a huge one.
Does the source give actual numbers on pregnancy rates based on her age?
It does, and they're pretty stark. Partner age 2024, 67% pregnancy rate after successful reversal. Age 25-40 drops to 54%. Over 40 plummets to 14%.
Wow, only 14% over 40. That really underscores how much female fertility declines with age, even if the male side is fixed.
It's a critical factor in the equation, absolutely. Has to be part of the discussion when considering reversal versus IVF.
There was also that interesting note about Dr. Brandeis' technique for the original vasectomy relating to reversal difficulty.
Yeah, fascinating insight. He says he performs the vasectomy in a way that's harder to reverse. His logic. Techniques that are easier to reverse are also easier for the body to undo on its own spontaneous recanalization, leading to failure of the birth control.
So he prioritizes the permanence of the original procedure, even if it makes potential reversal tougher down the road.
That seems to be the trade-off he prefers for reliability. He does say if a patient specifically asks for an easier-to-reverse method, he'll do it, but explains the caveat, slightly higher chance it might fail on its own over time.
That's a really important nuance about surgical approach. Lastly, cost of reversal.
Not cheap. The source puts it around $20,000 in 2021 dollars. That substantial cost is definitely another major factor when comparing it to IVF.
20 grand. Yeah, that highlights why the initial decision needs care and why that 72-hour wait exists. Reversal is possible, but it's a big undertaking, complex, costly, and success isn't guaranteed.
Precisely. It's an option, but not a simple undo button.
Okay, we have covered a lot of ground on Chapter 94. Let's try and boil it down. What are the absolute key takeaways from the source?
Right, the main points to remember. 1, vasectomy is super safe and effective for permanent birth control. 50 million guys worldwide do it yearly.
Effectiveness rate.
Should hit 99.9%. Extremely reliable.
Where and how?
In the office, local anesthetic. Often the no-scalpel way.
Complications.
Rare. Bleeding, infection maybe 1-3%. Some temporary discomfort is more common, maybe 1 in 10, but usually short-lived.
Long-term problems.
Source says no long-term complications from the vasectomy itself.
Sex life impact.
None. Sensation, orgasm, ejaculation, T levels all stay the same.
Back to work.
Desk job, usually the next day.
Mm-hmm.
And importantly for the future, the testicles keep making sperm. So options like sperm retrieval for IVF or vasectomy reversal are possibilities later if needed, though success varies.
That's a great summary. Really covers the core info. Reliability, safety, minimal impact, quick recovery, but also the options if things change.
Yet Dr. Brandeis really provides a clear, reassuring rundown in this chapter, addresses the key anxieties and questions.
It absolutely demonstrates the value of the 21st Century Man book. Getting this kind of expert insight directly from specialists like Dr. Brandeis on topics that matter to men is just invaluable.
Totally agree. Having chapters authored by experts across so many areas of men's health, all in one place, it's a fantastic resource.
We really encourage you, the listener, to check out the book, The 21st Century Man. Explore this chapter, explore others. It's packed with practical, comprehensive knowledge.
And if you want more specifics on vasectomy or Dr. Brandeis's work, the chapter references his website, www.BrandeisMD.com.
You know, this whole discussion about vasectomy, permanence, reversal, it does make you think, doesn't it? About making these big decisions when technology and life itself are always changing.
It really does. It touches on planning for the future, but also on what permanent even means anymore when medical science keeps advancing. Procedures like reversal, technologies like IVF, they sort of blur the lines.
Yeah, it's less about absolute irreversibility maybe, and more about the interplay between our choices, what science makes possible, and just life happening.
So thinking about all that, the effectiveness, the safety, the potential options down the road, it kind of leads to a bigger question for you, the listener.
How does considering something like this shape how you think about planning your own reproductive future? What does that look like for you?
Something to ponder.
Definitely. Well, thank you so much for joining us on this deep dive into Chapter 94 of The 21st Century Man.
Yeah, it was great talking through it. Hope you feel more informed about vasectomy now, the procedure, the context, everything.
And please join us next time on the 21st Century Man podcast. We'll be moving on to the next chapter, Chapter 95, Staying Fertile.
Looking forward to that one. See you then.
Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.